As I said this evening, we're talking about cancer, which is a subject really that we don't normally like to talk about. It's one of those kind of like tabooish kind of questions, We know it's out there, we know it's happening, but we don't really know how to engage in a conversation about it. I've got Kirit on the line here, and we're going to be discussing, a campaign that he's working on at the moment, if that's right, through VSNW. Kirit, good evening. Are you there?
I am here. Thank you, Irene. Thanks for inviting me to talk on your show about our work.
I need my headphones. Yes. Oh.
Yeah.
Sorry, I just realised I need my own headphones on to hear you, so you don't sound like you're a million miles away. Are you there?
Oh, no worries. I'm not a million miles away. It's nice. It's Leban's.
Yeah, I'm with you. So, you work for, what is VSNW?
Well, VSNW stands for Voluntary Sector Northwest, and it's an infrastructure and support organisation for the voluntary sector for the region. And yeah.
Okay.
And mm-hmm.
And we've been talking about cancer and something called Answer Cancer.
Yeah.
Is that a campaign?
Yeah. Well, it's a partnership. It's a partnership between various agencies, BHA, Salford CVS, and Unique Improvements, and ourselves, Voluntary Sector Northwest. We've come together to improve cancer awareness across Greater Manchester. So there's a partnership so that in order to raise awareness around cancer, because there's a need, particularly in the region. Yeah.
And I mean, I've often heard as well, because people do say that people that's from the African and Caribbean communities tend to, I don't know if it's right to say suffer more, because I don't know what other term to use, but maybe they don't come forward as much as other people would when it comes to cancer, or maybe they don't recognize the different types of cancer. Or is it that there's certain types of cancer that are more prevalent within the African and Caribbean communities than others?
Well, it's a good point you raised, because I think the challenge is that obviously, although Greater Manchester has got some of the best cancer services and kind of clinical outcomes, but they're also the worst rates for premature death from cancer. And we recognise, and it's recognised that both bowel and cervical cancer screening, Greater Manchester ranks 12th out of the 14 regions across England, while for breast cancer it ranks the 13th. So there's a lot of work to be done in terms of why particular communities aren't coming forward. And I agree that there are challenges within that. And, we've got Black and Asian minority ethnic backgrounds, disabled people, carers, LGBT communities, and people on low incomes coming from deprived areas.
Yeah.
They have worse outcomes. And so there's a need for this program, which actually tries to understand and get those communities to start talking about cancer. Why is it a big issue? Why does it remain hidden? And not speaking about it is partly because, as you rightly point out, is that there are myths and taboos about cancer. And
I was just gonna ask that. Is it because there's certain taboos, about it? Cancer. I mean, they see it as. Put it this way. I know the country where my parents hail from. West Africa, Nigeria. They see it as such a. I don't want to say dirty, but it's such a horrible. They say disease. Which and they think it's contagious. Some people think it's actually contagious, so therefore they don't want to talk about it. If somebody has it, they tend to keep them away, from others. It is such a taboo subject.
I think you're right, Rinma, because part of it is about the taboos and also about the finality of it. The fact that if you talk about cancer, that you're just going to disappear, you're going to go. So the sense of premature loss of yourself as well as to your family, that kind of permeates and pervades within our communities, is that it's seen as something to be frightened of and fearful of, and also not to share that, and also recognize that and also our faith communities particularly have a belief in faith, which is also a very strong belief, but also can be kind of also something which actually, so we have to pray it away, which doesn't necessarily mean that you look for help and support, which might be treatable. Might not be. It might give you, as we know, that if people are diagnosed earlier, they have at least 10 years more, maybe. But that means earlier intervention, and that means earlier diagnosis. It means that, that's another aspect of this, of the reason why people aren't coming forward, because they just don't know the signs or don't know where the symptoms. So it's a multifaceted issue. I don't want to minimize the the reality of people's lives about what it might mean to have cancer. But it's not a death sentence in the way that a lot of people, I think, see it as.
So, this time now, the climate that we're in at the moment, because we all know we're in the climate of, COVID-19.
Yeah.
And, unfortunately, there are so many people dying because of COVID-19 and, leaving us. Is now the time to be talking about cancer? Is there a connection?
That's an interesting point you've raised. I think we recognize that, COVID is creating the reality that it's impacting on people who are losing people to COVID, and that you can't minimize the impact it has on people in their lives, and also not being able to see each other. It's a very communal feeling that you can't see your friends, you can't see your loved ones, because of the fear of it being contagious and being able to pass it on. So I agree so we're also heeding that. We're recognizing that actually, how do we still, because it's what's also happening is that the reality is that people are also not coming forward because they're heeding government advice and instructions to stay at home, protect the NHS and save lives. But they're also saying, and it's clearly now, they're also saying, come forward. This does not prevent you from coming forward. If you are worried, if you have signs and symptoms, they need to contact their GP in the first instance. There is now a public health campaign which will remind people to contact their GP or call 111 if they need urgent care, or attend a hospital if they are told to do so. In the last resort, call emergency, call 999. So there is reliable sources of support information out there on the NHS website and reputable national cancer organisations like Cancer Research UK. They all point to say, do not sit on worried, be worried about your symptoms. Right. Just come forward. Because you're right, Rinma. Because COVID is taking as the big thing, everything else is gone silent. So there are less people going to the A&E. There are less people going forward. So that is going to have an inevitable impact. So what we're saying is, of course, cancer matters. We're talking about cancer, but actually, we're also saying people need to stay healthy. People need to have, improve their mental health. Look at the small ways that you could still, because those risk factors still stay. Those issues which actually are part of the cancer story, if you like. If you eat more healthily, if you exercise more regularly, if you have less alcohol, if you're allowed to, and if you have a kind of eat properly. I don't know. So those kind of things which are about healthier, improving your life, will help to beat the cancer, as well as the drugs and treatment.
Yeah, because you said before that I think this is what you said. Greater Manchester that it ranks 12th out of the 14 regions across England for bowel and cervical screening, and 13th for breast cancer.
Yeah, 13th. Yeah,
13th. So what you're trying to do then, with your, the whole Answer Cancer thing, what is that trying to do with regards to those figures?
Well, in the smallest way possible, is obviously there is an impact in terms of bringing. I think that the challenge for everyone is recognizing that the screening program, there are 3 screening programs. Obviously, the current COVID situation, there is that challenge in how do the screening programs operate. So our line is, that we want to encourage people. Those screening programs, they exist, and they're there for particular groups of people. So, for example, bowel cancer is for 60 to 75-year-olds, men, right? And women, men and women. But there's a home kit. Sorry, I'm describing it, but there's a kit for you to test at home testing yourself.
Okay, really. Test at home, a home test
test
kit.
At home kit. But that kicks in at 60. But if you're concerned, you can go beforehand.
Okay.
So, and obviously with cervical cancer, it's for 25 and above, right? So, but again, it's a limit in terms of. So the idea is, so we know that the communities that we are trying to reach are the ones who are less likely to come forward, and there's a reason why they won't come forward is because they're not. Well, there's a range of issues. I think partly that the service maybe culturally or not fully understand what their needs are. It might also be the fact that they're not aware that these services exist. And so the other part of it is that raising conversation within our community to say, have you share their post experience of cancer, learn and talk more confidently about cancer, raise awareness about cancer screening, and speak about why people in need are getting cancer. Talk about healthier lifestyle, prevent a risk of getting it.
And so, I suppose Sorry. I was going to say, I
No,
suppose
no,
it's one
no,
of
no.
those things where, I mean, if you don't see, it's the usual cliche, isn't it? If you don't see somebody that looks like you representing you or talking about those issues, you don't really think it's for you. So, therefore we have to, make sure it is culturally appropriate. So
Yeah.
having, people from the community maybe talking about these issues.
Yeah, we know that's an answer, definitely. I mean, it's partly called Answer Cancer for that very reason. We know that the answers lies within our own communities, right?
Right.
Whether, regardless of what your background or your ability, we know that anybody who speaks from that place knows how it will impact that conversation, and that's part of why the cancer movement started. It was a movement because we wanted to raise that conversation. You talk to your 3 or 4 family friends, they talk to their family and friends, and you kind of take away the myths and some of the taboos around it, and that way of sharing will hopefully create the space really for that initial conversation. And what we're offering as well is not just a conversation, but what we're saying is we also have support and training, and we also have funding to allow you to connect to your community and maybe engage with them. So there is all these ways that we can do that engagement. But I recognize, I'm recognizing that obviously during this period we haven't got that social space.
Well, I was going to say, how are you expecting people to connect with their communities?
Well, we're trying some innovation. I think like everybody, we're using technology, getting used to Zoom and the world of Zoom, and not just Zoom, because people are using different kinds of digital approaches. What we're thinking, and hopefully you can sort of communities out there will probably thinking the same thing. Obviously, these are the people who are connected, digitally connected, technologically connected. So we need to reach them because they have the means, but they also have means to connect to their people who might be through WhatsApp or might be using, they might be having those leaflets sent in, they might have access to people in their own networks. So what we're hoping for is that it will cross over in a gentle way, and so it's not forced. We recognize that this is hopefully, it's just one strand of it. We're bringing it forward. There's always an intention that we would use the digital, but that was some plan later in the program, but now we're bringing it forward because the reality is forcing us to take this step. But we recognize that obviously the technology is only for those with the means, with the finance and the money and the handsets or whatever it's called, iPhones or whatever, iPads and tablets. It's not for everyone,
Yeah.
And also, Garina, and I know that.
So
the people we want to reach are older, and therefore they're less likely to have it.
Well, exactly.
Yeah.
So because I think I read somewhere about this Answer Cancer is trying to create cancer champions.
That's right, exactly. Yeah. What we want to aspire to is cancer champions. Okay. And so what we're saying is that individually, as a person, you can be a cancer champion, or you could be an organizational champion. Because as an organization, you have access to, and you're part of a member, your teams, your workers, your funders, your partners. All of these people can have and share messages around cancer screening, because we all have 1 in 2 people will be impacted by cancer. So we know that actually individually we will all be touched by cancer, whether now or in the future.
So go on.
So I was just going to say, in terms of sign up, so basically we have a website, we have a Twitter, we have info. So there are ways to connect with us, and hopefully our approach is that anyone can be a cancer champion. And what that means is that they share their personal experience of cancer, talk to more people, become more confident about cancer. They're not really confident. There's training available. Speak up in their own communities, raise that conversation, and also obviously I'm not denying the fact that these are taboo subjects, and some communities will have to challenge some of their own thinking around it, some of the issues that may present. And each community will have its own way of, looking at the benefits of speaking about it, and also looking at why they might want to shut down this conversation. But the idea is that we should have that conversation.
Right. And so if somebody is a cancer champion, an individual, you said that it's just a matter of them speaking to a couple of people, or just talking about it. So, and if they're an organisation, I suppose they'll easily be using their networks, wouldn't they? So
exactly. And it's free. Everything that's what we're doing now is free. Because there's no charge for anyone. And hopefully, what we're hoping for is that these cancer champions will not just they might become a champion in their own right. For example, they could be organising once we're post-COVID and we can actually get out and be about. We can create these events where people used to do, like have a market stall, they might have a church event, or they could create, I'm thinking of a buy tea and cake kind of event. Meet and greet. There's so many ways of being a champion, and but it depends on the individual. It can be a small little step, or it could be something larger. And hopefully, what we'll have is communities from all the backgrounds and abilities involved and engaged with our work. That's the main idea.
Yeah, and you said that there's training involved.
Yeah, yes.
Is that for the individuals who want to be the champions?
Yes, there is training available, and there is for individuals. So they'll just sign up to what we're, on our. There's a website, and they can sign up there. And they can say what they want to get involved in. Yeah. And then hopefully from that we're able to take those names and then pass them on to our trainers. And obviously, we are trying to encourage people to come forward, but particularly from those communities that we know we haven't reached and we haven't accessed. Yeah, so we want to try to be fair, but obviously we want to prioritize those who need it most.
And you also said that there's funding available. I mean, because if somebody's already using their WhatsApp or their Facebook, what would they need funding for? Well, because we can't go out and buy a load of cakes, can we? And have a
No, I think what we're thinking is that obviously this is a very unusual time, but there might be some creative solutions to this period, right? So what we're thinking is that all those ideas might be within the communities themselves. So what people are using WhatsApp in different ways. So I don't know whether it's called like competitions or photographs. They can have a contest. They could create. I know that some churches are using Zoom for their sermons and prayers. So there are some ways that you can use the technology. So we're thinking that maybe this might be a way to, for the short period of time, use that technology to either to learn more about it and learn a way of how they could engage. And they might have people in their own communities who might come up with ideas for them to use this period really. So there are so the award is just to help as a way to kind of engage at this point. Yeah. So does that make sense, Zarima?
Yeah, that makes sense. Yeah. So the funding is just to enable them to enable themselves to engage with either their own community or other communities. Yeah. In a creative way.
Yeah, exactly. And whatever they have, what's available to them, because obviously it's not going to be face to face in the way that we traditionally would do it. This is just a way of saying, can we do it in a much more. I mean, you can see it already. People are doing, songs on, online. They're doing virtual songs, choruses. People are, finding, doing artwork, creating at home and then posting it. So we recognize that people are being. So that's been another positive outcome from this. That maybe people who weren't so confident, like myself, wasn't very confident on Zoom. Now actually I'm using it, and there is pleasure in seeing your friends who you haven't seen face to face for a while together on the screen. So. Even though I'm not a fan, I'm trying. Yeah.
So even if somebody wanted to use the funding to train themselves how to use Zoom, they could do that.
Yeah. In fact, Unique Improvements is offering that as part of the solution as well. They're helping to feed some of that learning so that they can, get some training to get confident around and hopefully put in. The application deadline is the 18th of May.
Yeah, I was going to ask that.
There's 18th of May is the deadline, but also they're offering Zoom. What do they call it? Funding session where they can talk about some of these issues and sort of raise some questions. There's going to be one. I'll put it on the website. I think there's information there already, which tells you the guidance note tells you that there's like a Zoom session whereby you can talk about those concerns. There's one this Wednesday, and there's one on the. I think it's the 2nd of May. I'll check.
Okay, so let me just ask you now before I forget. I'm going to ask you some other questions. But what is your website?
Well, the website is Cancer Champions GM.
Cancer Champions
GM.org.uk.
Hang on. gm.org.uk.
And our Twitter is at Cancer Champions GM.
Okay, Cancer Champions GM. Oh, that's easy.
Yeah. And email us is info@cancerchampionsgm.org.uk.
Right. Okay. Because I'll put those all on the podcast. You see.
Yeah.
So it's info@cancerchampions. And did it get through to you?
It'll go through to the info box, but it'll come to me or one of us here.
Is that info@cancerchampions.co.uk?
No, it's info@cancerchampionsgm.org.uk.
Okay, gm.org.uk. Oh God, where did I hear that? No, I mean I said something else completely.
Okay.
So basically, then this Answer Cancer is it a campaign? I keep saying campaign. Is it a campaign?
Well, you could call it that because we're about building a movement, aren't we? We're about
Right.
encouraging people to have action and make pledges and take action. Ultimately that's our goal. And what we hope to do and what we hope to see is that there are more people coming forward for screening because that's where because there's low take up and you won't change that unless you get people coming forward. And it's those who don't necessarily see it for them, and that's where we have to reach. You know what I mean? It's not the people who are more resourced or more knowledgeable. It's about the ones who don't know that they can and they should.
So what kind of people then are we looking at?
Well,
or looking to reach? What kind of people are you looking to reach?
We're looking at ethnic minority groups. We're looking at people who are low income, who are living in deprived areas. We're looking at carers. We're looking at people who are disabled people. We're looking at. Sorry, I think I mentioned all the groups. I think I have.
LGBT communities. Yeah.
Sorry.
LGBT.
That's right. Yeah, LGBT communities.
And carers. So basically, anybody really, anybody.
Well, exactly. I mean, there's everyone. I mean, the reality is that I suppose those are the groups who are more traditionally marginalized and probably disadvantaged because of who they are, and where they live, and what income and resources they have, and their connection and their contact. And also, it's not a generalization, but the challenge that they face, health might not be a priority. Other things are more priority. So we recognize that these things go hand in hand. It's a wider health question which actually arise, as you know, that we are more riskier, not to say riskier behavior, but we're at risk of all these various
That's right.
Life throws at us. Yeah.
And can we just go back to the funding? How much is the funding, and
what's the good question. The funding is up to £1,000, and they're up to 1,000 or up to 2,000. So there's two pots you could apply for, up to 1,000 or 2,000, and 1,000 is for the idea behind both of those pots is to sign up cancer champions. So that will come with the guidance really, and I suppose the idea behind it is that the people you're signing up are people who are connecting to it, to what they're being told. So that the part of our work is the engagement, that we would go out and engage people around what we're trying to do and the message we want to share. And the second part is to get people to become part of a wider movement.
Right.
And that part is about organizations and individually coming together as a collective and recognizing that together we can challenge and fight cancer.
So basically you wanted people to, well, if it's an individual, they have to, I don't want to use the word recruit because that sounds like you're giving them a job, but get on board
exactly.
Other people.
Exactly. And we know so far that there has been at least, we've got about over 7,000 or up to 7,000 people signed up already. We had a big target, of 20,000, and we're on that way. I suppose the reality is that it's about what people do and say and encourage really, and see that translate into the actual numbers of people coming forward and being screened. Now, obviously, under these conditions of COVID, we can't do that in a way, but we hope that we can utilize this time while we're under lockdown. Is that the right word? while we're restricted to our four walls, is to do those other things that we know we're doing, which is actually we are having conversations on WhatsApp and phone calls and emails and text. And, there are these ways which are digitally, powered. But those are the ways we can actually continue this conversation. And, so hopefully people will sign up to the Twitter account for those who tweet. And those who like to email can email. And those who like to do Facebook. So we're trying to utilize these other approaches, but also at the same time, hopefully, is that communities also using their own networks. They might be using Facebook, or they might be using WhatsApp.
I read somewhere, and I know it was in the literature, that you sent through and on the websites, that as an individual, you'd have to get 25 people, and then as an organization, they have to get 50 people. Because how does that work?
The idea is that those groups who get funding would be a constituted group, so they have to be an organization. So they wouldn't be able to go apply individually for this fund. They have to be part of a group. Yeah. They have to be constituted, or be a group that actually, So the limit is that I think it's £250,000 income for the group or the organisation. So they as a project or they as a community group would sign up either 25 individuals or 50, depending on which part of funding they
25 or 50 individuals from within their group.
Yeah, from within their community. Yeah,
within their community.
Exactly. Within their community. So, if I was working, say, within a black-led organization, black community, and if I talk to my community and said, we're doing this conversation, would you be part of it? In a normal situation, you'd probably be out there in the community, and doing this quite naturally. It's much harder to imagine this in a kind of digital way, but it is. I mean, WhatsApp groups can be, can have hundreds of people in them.
That's right.
Isn't it? And I think even with WhatsApp, people get simple messages, and we're not asking to share complicated messages. We're trying to keep it simple. What do you need to do?
Yeah, but then how would you? I mean, I'm a bit confused.
Go for it.
Because before you said that a cancer champion can be an individual or an organization. Yeah. So if you're an individual, do you still have to recruit 25 people?
No, you don't need to. As an individual, you're signing up for yourself. This is it. You're signing up for yourself. As an individual, you're just signing you up. You're putting yourself forward.
Okay.
You know what I mean? As a champion, yeah.
But as an organization now, you could... so is it only organizations can apply for that funding?
It's only organizations or groups.
Right, I'm with you.
Yeah.
I was thinking it was both individuals. That's what I was thinking. How is an individual going to do that?
No. An individual would all our money would be gone. It would be all gone. No,
I think we're understanding it now. I think we're understanding. Yeah. So therefore, if an organisation signs up, what an organisation then has to do is sign up 25 or so of their own members or people from within their network.
Yes, exactly.
Right.
Exactly.
And those people would naturally, hopefully, would pass on certain messages through their own social media, and then the word is getting out there.
Yeah, exactly.
Is that correct?
And I think at this point, in this particular time, what we want to do is the message we want to give out is that people need to stay healthy, stay physically and emotionally healthy, stay connected while social distancing, while these social distancing measures are in place. We want to encourage use of health services when there's serious health matters. We're still promoting awareness of cancer symptoms and signposting that they need to go and get help, not to sit on it. We want to recruit these champions so that they can still pass those messages. That they're doing a good job, you see, because even if they're not doing it, they're doing it, they're contributing. And
of course,
champions are willing to sign up and share their knowledge, their experience, their skills to others. So they become part of a wider movement.
That's
and share
right.
Useful messages, through their own personal links and contacts. So hopefully, all of this comes together in a positive way.
And do they have to then report to you as to the names or the different people that they've signed up, or do you just follow them?
The organizational, obviously, the grant funding is slightly different because it's financial, it's money, So those who are successful through the grant funding have to report back on that funding. But for individual cancer champions who sign up, they are volunteering their time and so in that sense, there isn't a reporting mechanism as such. All they're doing is sharing with us their personal experience of sharing that story. Recording in whatever way they do. They take a photograph and they share that story. It's whatever works for them. It's not onerous. It doesn't meant to be onerous. It's meant to be simple. Raising awareness about cancer. But obviously, it helps to know how well they're doing. What's working in the community.
Yeah. So if they use
that's the bit that we obviously need to work on with the cancer champions.
Well, I was thinking they could use your hashtags and things like that, couldn't
they?
No,
exactly. Use a hashtag, and share that wider message. And as long as they're sharing, think messages which are important, and that's the important part of it.
So, Answer Cancer is the working name then.
Yeah, Answer Cancer is the working name. Yeah, exactly. It's a name to talk about the partnership between these four very different organisations who come together to create this movement of, the social movement really around cancer awareness through cancer champions.
Is there any other resources? I mean, apart from the funding, do you have any? Because I can see on the website they've got people in these kind of like wood card frames.
Yeah, there is resources. Yeah, there are resources in the sense that we want to build up those kind of ways that people can start sharing those messages, and so there are these placards and stuff. I think some of those things might not be easily available to us because we're under lockdown. We can't get to these things.
Oh, anyway, that's true. Well, no, you can you can post them. You can still post things out. Like if we wanted one for Radio Africana, I'm sure you could post us one.
We'll find a way. Where there's a will, there's a way.
Yeah, exactly. Where there's a will, there's a way. If we want to get one, you'll get one to us.
Yeah, exactly. And we are thinking of different ways that this the champions movement can really speak to each other and also share their good experiences, what's working with them and what's holding them back. And so those things will inform the progress we'll be making over the next couple of years. Yeah.
That's good. So basically, what we need to do is boost cancer screening in Greater Manchester, really. To also save
and
lives.
Because as we know, there's three cancer screening programs on bowel, breast, and cervical.
Yeah.
There's those 3 cancer programs. And there isn't one around prostate cancer, partly because prostate is very hard to measure. But I'm not a medical professional, but I can know from my reading that prostate isn't a national screening program, but we have national screening programs against those 3. So yeah.
Okay, so it's those 3 that we're concentrating on. Yeah, I'm sure we can take part in that here at the radio. That's something we'd like to take part in.
Can I sign you up then? Can I bring you a spot there?
Yeah, sign us up. I'm sure we'd like to take part in that.
Okay,
and we've got a huge network. So I'm sure we can send messages out through, our social media. I might actually look into the what's this called? The funds. Actually,
please do.
We need those to pay our rent.
Yeah. Well, whatever helps at this time.
Yeah,
sure.
That's right. To be able to, but it's a very important conversation to be having, even right now, because like you said, with COVID-19 at the forefront of everybody's, mind, body, and soul, we tend to forget about the other things that are just as important, in lives.
No, exactly. And there is already people from, if you watch the news and the background, you can see the NHS senior officers and officials saying, because of the unintentional consequence of the lockdown, and people are frightened of coming into contact with people who might be affected by COVID, and therefore they're not willing to go. They're frightened of not being a burden on the NHS, and therefore not wanting to, because they're listening to government advice, stay at home, protect the NHS, save lives. So, remember, this is part of the challenge, is that to say, yes, of course, those things are important, but also be aware of your own body. The final message should be, your body, your body best.
Yeah.
If something doesn't feel right, then you need to contact a health professional, contact your GP. And, they might not see you in person, but they will definitely find a way to talk to you. And, and
another thing I wanted to ask is, we want to create these cancer champions, and the question has just come in. But what, it's going back to training our people, because obviously most of the people coming forward are not going to be medically qualified.
Yeah.
Do they need to be medically qualified?
No, they don't need to be medically qualified.
Right.
There's a training module. There's some online available now, actually, because Cancer Research UK have got an online module which they're making available for the next 5 weeks. So I can pass that. I can share that with you.
Okay.
Because, that's one way of actually sharing that resource. It's a very good resource. Because in a way it's about tackling the myths and some of the misconceptions around cancer. So it is basically sharing those practical ways of talking about it in a way that actually you're listening, you're not nagging, you're not forcing people to take unacceptable truths. If you're talking through that journey really of how to listen and share and tackle some of those concerns that people have around cancer.
That's right.
Personally, I lost my father-in-law 3 years ago to prostate cancer.
Oh, dear.
And it was heartbreaking and difficult because, again, it's because he buried his head in the sand. And he didn't want to look at what was going on too closely. And by the time it was brought, obviously he did manage to have at least 10 years, but it could have been longer. And so for us, and it's for community to know that it's preventable in the sense that, like all cancers, there are around 200 different kinds of cancers. Each cell of our body is potentially to go wrong.
Cancerous,
our human body is not perfect.
Well, they do say that we have cancerous cells within our bodies anyway.
Well, I'm not a medic, so I don't know about that. But I know that our cells are likely to be the DNA, the genes might go can become cancerous because of the tumor, and therefore and so there's a whole over half, 53%, I think, of cancers are the ones which are recognized. Lung cancer, breast cancer. The main big ones. We know about them, and lots of charities and foundations work around those issues. So, this is something that can be tackled.
It is something. Like you said, my father, he didn't pass away of one of those 3 cancers. He had myeloma, which is cancer of the white blood cells. But it was diagnosed from it was first diagnosed, he actually lasted 25 years and lived to the age of 92, and that's because he was getting treatment for it. Although they did say whenever he went back home, I remember the consultant in his latter days, even latter weeks, I should say, his consultant said, you know what, I don't know what your dad either eats, drinks, or even smokes when he goes back home. He said, but whenever he came back to the UK, his cancer was in remission. It's the longer he stayed here, then it would build back up again, and then you start having to have the chemo, you know. But no, the point I'm making is that, you know, he was getting treatment, and he lasted another 25 years from first diagnosis. So, you know, I suppose I know that, yes, if it's diagnosed early, people can get the right treatment. And yes, you may be taking that treatment for a good 20 odd years, but at least it will, you know, prolong your life and give people that opportunity to plan, you know, to do certain things with their families rather than it being so sudden. Because like a very close friend of ours lost his father not too long ago, and his father had bowel cancer, but like you said before, he basically just buried his head in the sand about it. And when it got so bad and he was actually admitted into hospital, he was there a week, you know, and everybody was like, oh, just a week, and they said, look, he must have had this for a long time, which he said he had, but he just hadn't done anything about it. And so
I think that no, this is it, and I think part of it is that it's regrettable that, you know, more people are dying as a result of fewer people that are diagnosed and therefore not being treated. So we need to change that around. We need that conversation to happen. We need people to know what they're looking for, you know, and the symptoms and the signs around that, and then hopefully, and then go, you know, and seek help and treatment. And so the screening program obviously is only focused on particular cancers. I mean, obviously there are those smaller, minute cancers that are not well recognized, but the ones which are focused are the ones which affect a vast majority of the people in this country potentially. So that's where the attention and energy is put, and it will reduce and increase the lifespan of people. So that's the thinking behind it. And also, you know, the other aspect of healthier lives is eating more properly and having, you know, eating properly and sort of exercising more. Things that obviously I can learn from too. I'm a 56-year-old person now, and I should behave myself too.
Well, do you know what? I think the one thing this COVID has taught some of us that we've been forced to cook, you know, because you know all the fast food stuff's all shut, isn't it? You know. So,
no, I agree. I think more people are learning to enjoy learning to cook more and make that from home.
That's right.
Yeah. There are some positives to that, although it's still harsh in terms of the wider impact on people's life. It is.
But one of the positives is to become an answer cancer champion.
Yes, definitely.
That's right. And how do we do that? If we want to do that, how do we do that?
Well, you go to the website. So there's a cancerchampionsgm.org.uk. So you can sign up. There's an individual sign up there, so you can just put your name and your details, and they'll be asking a couple of questions and a series of, you know, just to get a sense of where you are and what background you're coming from, and then that's the easiest, simplest way is to do it via the website as an individual or as an organisation, and then the other approach is to contact me directly, and that's using my info at cancerchampionsgm.org.uk, and then you come via me, and then I can talk to you and have more of a longer conversation, and we can get you started if you haven't already started already. I
know, and let them know there is resources there. There's training.
Yes. There's resources and training, and all of those things can be arranged as well once you go on board. Yeah.
And I'm looking at the website. Yes, it's very simple, very nice and clean and simple, and it just has one button to press.
Yes, great.
Yes. Cancer,
good to know. Thank you, Rima, for your thumbs up for that
champion. Yeah, it says Cancer Champion, so it's very easy, that is. So it's just one green button, press the green button. So, you know, if what you've heard this evening inspires you, if you've been touched by cancer or know somebody that has, and would like to be a cancer champion, and Kirit, you said it, you don't need to be medically qualified, do you?
No, you don't need to be medically qualified.
No, don't need to be medically qualified. Any questions that they have, they can actually ask you or put them in on the website. But then there is training, so people can actually ask their questions. And I know some people might be thinking, well, how are we going to attend the training if we're on lockdown? I think the training is being done, is it by Zoom?
By online, there'll be ways to do it in the meantime while we wait to get face to face. But there will be ways to get you started. And as I said, there is a Cancer Research UK online training available, which can be done over a matter of 3 weeks or longer, but it's available. Yeah.
So is there anything else you'd like to add before we end the show?
I don't know if I've covered it, but I think I want to thank you, Irma, for giving me the time and the space to talk about this very important issue.
It is.
We recognise that, the situation is quite, maybe very intolerable for a lot of people, feeling very isolated and lonely. And hopefully this program, this conversation around cancer will show that life is going to impact us in different ways. But let's not make it more worse. Let's work together, share, and be supportive of each other at this time.
Yeah, because we need it at this time. And there's, there is quite a lot of people that may be on their own or isolated and worrying by themselves. So they may just need, someone like an Answer Cancer champion, to give them a call and just say hi or send them a text message, so that they know that there's somebody else out there, that understands. And I suppose it's that empathy as well, isn't it?
It is that empathy, and I think, as you know, I think part of it is that we want to be people speaking from their own personal experience, who understand it, and who can talk about it confidently.
Yeah.
And obviously, there's some technical issues that might, don't need to get into. All it is about sharing, not spreading myths, and that's not what we want to do. We want to share common sense, practical.
That's right. Yeah. No fake news. We don't want no fake news or no fake.
No, we don't want fake news. No, definitely no.
No fate news. There's enough of that going round. There's enough of that going round. Yeah. All right then. I nearly called you Cancer then. Kirit.
Having all these co sounds.
Yeah. I know, it's all the k. All right, Kirit, thank you so much for joining me this evening on the Charisma Show. And thank you so much for all that information. I will put something up on our podcast straight away so that people can either listen back to the show, so that if they missed any of the information, with all the websites and that, they can, listen back and find the information there. But don't worry, Radio Africana will be joining you.
Okay, thank you so much, Kirit.
All right, thank you. Thank you, Kirit.
For having me on. Thank you very much. Talk to you soon.
Yes, you too. You're welcome. Bye.